Hi everyone, I'm Jackie. I'm a registered nurse from the Snowy Mountains region in New South Wales. I usually like to start with a fun fact, and my fun fact for the day is, did you know you can get so nervous the backs of your knees sweat? Because I found that out this morning. So that's what I wanted to share with you today. I also wanted to recognise and pay my respects to the traditional owners of the land, past, present and future. I'm a little bit the Stephen Bradbury of nursing. Does everybody know who Stephen Bradbury is? I feel like that's me. So my slides aren't full of stats and data. It's a personal account of my nursing life and my life in general. So this was a poster put together by the local council to help support the work that I do in the Wednesday room. Today I'll be sharing with you the who, what, where and why of a nurse-run clinic, but it might help a little bit first to explain a bit about myself. I grew up on the central coast of New South Wales with my two siblings, my parents, my grandparents and my two aunts who were born with spastic quadriplegia. I come from a community-minded family and my community supported my family. My grandparents' house ran as an unofficial neighbourhood centre with constant tea, cake, a meal and a bed if it was required. There was always a project, a listening ear, a barbecue and, as I said, a bed, which I think is something that communities don't do enough of anymore because we get too worried about personal gain and not what we can give back to our communities. I grew up in close contact with GPs and community nurses as well as the practice nurses that lived across the road from my grandparents, so we were very well located to receive that support there. And as you'll be able to tell from today, community is very important to me. I have my 11-year-old daughter here with me today. She had her knitting needles taken off her at the airport, so she's been knitting with chopsticks, and I want you to know, baby, that innovation comes from your mother. So I'm just nervously going to click through a few slides, and like I said again, it's just kind of pictures and stuff about what I do within the community, and there's a lot of my big fat silly head there doing the things that I like to do. I did not enjoy working within the hospital setting and honestly struggled through my first 5 years of nursing. By moving into general practice, I've been able to learn and grow and develop my nursing skills with an incredibly supportive specialty, and I do consider general practice a specialty. That's my favourite slide from our patient survey because the person either really liked cannabis more than once a month or had just been using cannabis and thought they'd draw me a little picture. So about the Wednesday room and a little bit less about me now. The Wednesday room nurse-led clinic in the snow resort town of Jindabyne, New South Wales was set up to provide affordable healthcare for the youth demographic visiting our area during the winter season. And that's the treatment room of the clinic where I work. So the Wednesday room's just one afternoon a week, and the rest of the time I work within the practice and in a skin clinic with a GP who cuts out lots of skin cancers. Our population swells from about 5,000 to between 20 and 30,000 depending on how good the snow is. Over that winter period, our clinic has to adapt to the increase in the need for health services. Initially, the practice had a staff meeting to see what demographic we weren't servicing adequately, using the practice software to check the details and run queries. Well, that's me. Thanks, Acon. They gave me heaps of condoms. We had a low number of patients aged 18 to 25 years attending the clinic, despite the mountains being staffed mostly by this age group. A conversation took place to see what healthcare needs may be required within the community, especially during the winter time. That's my husband. He's in a lot of trouble for that. That blew out a ski season and my mental health, that injury. And there's some funny things you get to see in Jindabyne. That's an emu swimming across Lake Jindabyne. I'm so rural, I just got Uber this morning. I was so proud of myself. So a conversation took place within our practice. We asked people within the age group as well who did attend the doctor's surgery what things might be helpful for the people visiting the area and for our local people as well. We had a lot of underscreened women for the then pap smear as well, so that was another thing that we had to add in. A part of my volunteer work at the local high school, I answer health-related questions for students in years 9 to 12. I wanted for young people to know that you don't have to be sick to see a healthcare professional, that you can ask questions about all aspects of your health. And if you're worried about something or someone, and even if you just have health questions, as a young person, I thought you had to be hurt or sick to see a doctor. I didn't know you could go in and just talk to someone about your worries. And there I am at the school with Liam Murphy, the roaming pharmacist. So I extended the talks to include staff induction at Perisher Ski Resort, where initially the information presented was a brief description of services available in the area. By the second session, which was the week after, this extended to include information on the importance of caring for your mates, STI information, ambulance cover, and a short session including questions and answers at the end, so that could help me to gauge how can I do better the week after and the week after that. And that was a beautiful letter that I got from one of the kids at Perisher who came up and asked me a question, and we got into a pretty good discussion. So I love my love letters. Just a good little boost to know that you're on the right track and doing the right thing. Starting the clinic was important to our practice because we wanted to provide affordable care to all members of the community year round. And with summer tourism now rising and both high schools now running from kindergarten to year 12, we've seen an increase in our general year-round population. So the Wednesday room commenced in 2013 to help address the issues of healthcare for the transient staff living and working in the ski fields. And some of the issues that we wanted to address were the high density living. That's me and Nurse Danny, who I love her, she's so good to me, and that wonderful support that you get in general practice that I actually, unfortunately, never really experienced in the hospital system. This lady made me, and she probably deserves to be up here and receiving awards as much as I do, to be honest. So we had a look at the high density living, low wages, high rent, kids living away from home for the first time ever. And sometimes kids want to just come in and have a chat because they don't know how to work the washing machine. They've never paid a bill before, or they just miss their mum a little bit. So sometimes they just come in and have a bit of a chat. We also see a high drug and alcohol use, and of course those ski-related injuries. And our clinic's really heavy on including the community as part of the clinic, which I love. The winter season, of course, has a flow-on effect for our local community. We needed to have a free service for STI screening and advice, immunisation, mental health support, and the then pap smear and now cervical screening test. And we found that these themes were common among those mentioned by the school-aged children and the young people that came into the clinic and who spoke to me at Perisher, so I'm constantly looking for that feedback. Once we'd gauged what might be required, a discussion took place within the practice, negotiations made with the practice manager and head GP, and alongside Dr. Tanya Robertson, I attended the sexual health clinic in Canberra for ideas on pre-clinic surveys and clinical support and advice. With my education complete, support in place in terms of a GP to support my work, and a need identified within my community, Tanya and I put together the patient survey, purchased business cards, and set aside space for bookings. I had completed the Well Women screening course with family planning in 2004 and had some experience and a keen interest in this area of nursing. Having had 2 of my own children, that was them on the trampoline just before, and volunteering with the Australian Breastfeeding Association helped me to build my personal communication skills and make connections within my local community. That's my practice manager, Gabe, when a TV crew come in to take some amazing photos of our clinic. Thanks, Gabe. Further education and information was required for me to practice confidently under the supervision of the GP. These 2 people are they've adopted me as a granddaughter, and I love them very much. I made contact with ASHM, ACON, family planning, and of course, APNA, to start the clinic. I had the support of management, the other GPs, the registered nurse who I job share with, and all these people continue to be a wonderful support to me today. Further education and support came from the GPs, NPS Medicine-wise, the Canberra Sexual Health Clinic and Family Planning, who also had a wealth of educational activities and patient handouts, which have been really valuable for me, because then that doesn't cost me money. I don't have to print off a bit of paper. The kids don't have to walk around with a bit of paper. They can access it on their phones. We didn't need a great deal of physical resources to set up. We had no funding. I paid for my own education, and Tanya and I purchased our own business cards and all those bits and pieces. I spoke about the Wednesday room at both schools, Perisher, Thredbo, every cafe in Jindabyne, to other mums, teacher friends, people who know people who know people who own pubs, beauticians. That's because everyone goes in for their waxing at the beautician, so they might need an STI checkup. And anyone who might put up a poster or keep a small basket of condoms with a card letting people know about the service. Free health talks were provided to the local CWA and the church, I know. The op shop and the neighbourhood centre, places I would not have attended previously. I attended high teas and discussed condoms and STIs, which went down a real treat, surprisingly. I had a panic attack in the car park afterwards and was surprised at the places that were interested in the story of the Wednesday room. My kids made hand-drawn posters and sticky tape condoms to the back of the business cards. Please don't tell the grandparents. Outside of professional bodies, I networked and became more connected with my local community, which was good for me and my mental health, but good for the community as well. The community elders, who I showed you before, encouraged me to get in contact with the Lions Club, the local bowling club, Southeast Radio, ABC and Snow FM, both ski resorts, local schools, Coordinator, church and all those places that I've, professional bodies that I've mentioned before. Initially, all the work I put in outside of the clinic was completely unpaid. A lot of it still is. I'm pleased to say that Perisher now pays me to provide health sessions at their staff inductions, which run once a week for 5 weeks every year, which I think shows a real social responsibility, and that's been really important to me. Results and outcomes in terms of an evaluation. Is it successful? I don't know. Sometimes at the end of the day, I think the sun has shone out of my ass for 8 hours straight. And other days I'd go home at 10 o'clock at night and cry in the bath while I eat a burrito. I wanted the clinic to be booked with patients. I wanted it to be well accepted both within the practice and the broader community. I viewed success of the clinic in this way. The clinic also needed to break at least financially equal, otherwise I was going to be told this can't keep going. Oh, that's my mission statement. I'm not very good at putting together a perfect plan. By the second week I was booked for an entire afternoon session, which continued for the remainder of the season. There was enough interest within the local community for the clinic to run for a half-day session all year round. And that's my friends, little kids who come in to visit me all the time. This is a local motorcycle group. Just a few images from down the road of my house. So 2017 was the 5th year for the Wednesday room. It's fully booked now every week with up to 20 patients a day attending for screening and advice. Pathology services continued to agree to bulk billing. The clinic not only breaks even in terms of finance, but with my improved skill set and continued education, we've been able to create an income for the practice. And then on a personal level, not only do I work within the clinic, but now provide education sessions outside of those places I've already mentioned, but for information on drug and alcohol use, along with advice for safe partying and where to go for help. And I'm paid for everything bar the school programs. I don't want the school to have to pay for me. Schools don't have enough money as it is. The service has been so well recognised within the community that in 2016 on Australia Day, I was awarded the Citizen of the Year for the Snowy River Shire. And I know I'm probably almost going over time now, but I really do love what I do. It took a lot of hard work initially, personally perceived failures, reassessment, education, connection with the community, passion, support, preparation and flexibility, and shameless self-promotion. We got rid of a lot of ideas, we introduced a lot of new ideas. We've continued to take bookings and also have walk-in appointments available because that worked better for people. The initial idea has grown from in-clinic care to education and support for the broader community. In addition to my work in the Wednesday room and the treatment room following further education, I'm now providing drug and alcohol and safe choices information for snowy hydro contractors. That's a typical Wednesday night dinner because Wednesday's payday. And working alongside Sam Thompson from Save a Mate. He's from Brisbane as well, so give him a little bit of a Google. He's doing some amazing stuff. And providing volunteer assistance at music festivals. It's been very important to network and stay connected with other passionate people within my community who truly care and who are making positive changes in their community. And that's me. Thank you.
I have spoken to Jaclyn on the phone quite a lot, and I've always been really excited to speak, so it's lovely to meet you.
Thank you.
I think one question. Yeah, and then it's okay.
Jaclyn, one of your slides showed that I think you're working from a super clinic.
Yeah, yep.
So do you think working in a super clinic makes a difference compared to if it was, say, just a normal run-of-the-mill GP practice?
So initially when I started the Wednesday room, we were in a small renovated shop front, which we had 5 GP rooms set up in. And when we moved over to the super clinic, I was really worried that my service would be lost and would be farmed out to New South Wales Health and that I wouldn't exist anymore. Yes, it has improved the service in that a lot of pressure's been taken off me for sexual assault work because I see victim and perpetrator, and that got really quite difficult to deal with. As well as a drug and alcohol nurse comes in about once a month now. So and we got up and running without being in the super clinic setting, but being in the super clinic setting, although initially I was concerned about loss of service and loss of, I guess, control of how it all ran, it's actually been a really good support for me personally, as well as having that instant referral avenue for the clients that I see, so they can be seen often on the day. So they've brought these people in on a Wednesday when I'm there, so it can happen straight away because these kids can't wait. Thank you. Thanks everyone.